My name's Caitlin. I'm the Operations Manager at Norfolk Care Association, and really excited today to bring you this presentation from Earzz. Joining me today, I have got Raj Sahgal, who is CEO at ArmsCare and also one of our directors here at Norfolk, and we've also got Prad from Earzz. He is the founder and CEO of Earzz, so he's going to take us through some work that Earzz and ArmsCare have been doing together with their acoustic monitoring system and how it's helped reduce falls and really help sort of support carers and residents at ArmsCare and their residential homes. I'm going to pass over to Prad to do a bit of an introduction and we'll get stuck into the presentation. Over to you.
Good afternoon, everybody. I'm Prad. I'm the founder of Earzz. Today we'll be talking a little more about what we do at Earzz, but more importantly, I'm keen to hear from Raj as well to see how he's been benefiting from the solution that we've built. Raj, do you want to say a couple of words before we get going here?
Thanks for that, Prad and Caitlin. I came across Earzz and Prad in a conference somewhere about 3 years ago. And my sort of interest in Earzz was primarily to do with the fact that I have sleep apnea and I have a sleep app on my phone which monitors the quality of my sleep. And what I found is if I didn't get good quality sleep that night, I would be really tired and with sleep apnea, falling asleep during the day, and lots of afternoon naps were necessary. And I just put it down to the fact that maybe I was getting old, but actually it was to do with the lack of sleep. What I found is that the better the quality of sleep I had at night, the better I was during the following day. And when I came across Prad and his acoustic sort of monitoring devices, what we found was that we tried to link the two together. And with those devices, we sort of thought, well, hold on, what if our residents could get better sleep at night? What if they had a good night's sleep, weren't woken up, weren't disturbed, and perhaps be more alert during the following day? And that's when we started talking about 3 years ago. We sort of worked on a trial, and basically the product sort of went from strength to strength. So what started off as a concept idea is now fully fledged operational AI advancement in acoustic monitoring, and the results have been tremendous because we've experienced things that we weren't actually looking at the time, which was like the reduction in falls by making sure people got better quality sleep.
Thank you so much, Raj. So you've set the precedent there. So let me talk a little more about what we do as a solution and maybe hand over to you on expanding on the results that you've seen as well. So as far as Earzz goes, what we do here is build these little pods that you can see. I don't know if you can see my video, but you can see these little acoustic monitors. And we focus a lot on impact. So anything we do, we want to make sure adds value, and that has translated into a number of awards, as you can see up on the screen over there, but also into partnerships. As a company, our mission is to make sure we enhance the quality of life for residents in care, but also for deaf and hard of hearing people. And the partners that we have, you can see it's pretty much in that space. So we partner with a lot of care associations, but also with we are integration partners with PCS and CareVision as well. So that's something I'll talk a little more about as we go through the presentation. In terms of what we offer, we've got these acoustic solutions, but the first thing that comes to your mind when I say an acoustic monitor is a baby monitor. You've got a transmitter, you've got a receiver, and you leave the transmitter in the baby's room, and it just simply transmits the sounds to a parent who then needs to listen to work out if there is any sounds of concern. That is exactly what we do not do in Earzz. What we've done here is built these systems to have the intelligence to identify, recognize, and delineate the sounds all by themselves. So the system can tell the difference between a person coughing, a person shouting, a person even trying to exit the bed, beginning to move out of bed. And why is that useful? It comes in really valuable in a number of care settings, and that's going to be the focus of our conversation today. We're going to talk a little more about how it applies itself in elderly care, in dementia care, and nursing care specifically. So when you think about elderly care, the system can tell when the person's trying to exit the bed. So it detects the sounds of movements and alerts the carers as they begin the bed exit. And why is that useful? Again, it really is valuable to try preventing falls from happening. So giving you an early warning here by sending you these alerts within 3 or 5 seconds of an event happening gives a much better chance of preventing a fall from happening, especially in cases of residents being frail and are of a higher fall risk. When you think about dementia, again, the system can be super valuable. For those with limited mental capacity, as an example, the system can alert um, when they begin vocalizing in the room. So they don't need to necessarily push a call button. You have a number of nurse call systems deployed in your beds today, but if the resident does not have the mental capacity to push a button, it becomes very difficult to get the assistance when it's needed. This system, on the other hand, can recognize when they're coughing, when they're shouting, and begin alerting the carriers as and when that happens. And we've seen this having a tremendous impact from a responsiveness standpoint, but also from the sleep quality that Raj was talking about for our most vulnerable residents. When you think about nursing care, again, the system can detect the onset of coughing, chest infections as an example, always manifests itself as coughing. And this is a sound that the system picks up as well. It also tells when the person's vocalizing, so when they're shouting or screaming more. And this could also become quite valuable. In fact, in a recent webinar with Care England, we talked about how this was used as the first cue to identify the onset of UTI and sepsis, because the person began vocalizing a lot more than usual. And what underpins all of this is not just sound recognition, but the smarts to understand behavioral patterns. So the system uses the sounds recognized in each room to uncover changes in behavior on a resident-centric basis, on a person-centered basis as well, which comes in very valuable in a number of settings. So how does the system work? It's fairly simple. You've got this little pod that we install quite close to the resident's bed, as you can see over here. And the system then begins listening for specific sounds of concern as chosen by the manager. Unlike other systems in the market, the managers or the management team can choose the sounds that are relevant on a per person basis. So if a person is of a high fall risk, as an example, they could choose to alert for sounds of movement in the room. Choose the system to alert for sounds of movement in the room. But if it's if they've got limited mental capacity, as an example, but they're not for fall risk, you could even alert for the sounds of vocalization or a combination thereof. So you could choose what's relevant, and then you could begin the alerting schema as well. And any alerts would come straight onto the carrier's handset. So the same handset you use today for your care administration purposes. So it could be the PCS handset, Care Vision handset, and it just comes straight through. And unlike other systems, it would tell you where the sound's coming from. Here in this case, let me zoom in so it's clearer. It tells you which room the alert is coming from. It also tells what the sound is. So there is no listening by the carrier on the other end. It just tells you what the sound is. And it also then asks the question, will you be attending? So now let's imagine one floor with 10 rooms as an example, and 2 or 3 carriers manning the floor. And let's say a couple of them are busy with the other residents, and one of them is able to attend. As soon as they get this pop-up message, all they need to do is simply tap yes directly from the notification. And that then sends an alert to the other carriers saying carrier 1 will now be attending to room 5. And once they are in the room, there is a little button in the system as well. So tapping the button there will register their room check. So today you may be using QR codes like you do with PCS and other systems. This, on the other hand, registers the room check through a button push. And this attendance register is also sent directly into your CMS solution like PCS or Care Vision. Again, what is the impact? The impact is quite profound. What this really helps with is fall reduction. The risk of falls are being reduced quite drastically, and we've seen a hit rate of about 80% reduction in falls. And Raj is going to talk a little more about our journey with him and how the falls have reduced at Terrington Lodge and Docking House as a result of us deploying there. Because we've got this little button, that also means anytime an alert is sent, we can start quantifying the time to respond to the alerts as well, because we also have the ability to digitize how the room checks. So you end up seeing when the alerts are sent and how quickly the carriers are responding as well. And all of these operational metrics are shared with the management team on a daily basis through our dashboard. There is a huge improvement in sleep as well, and this is because you're not relying on a person who does not have the mental capacity to push a button. The system understands when they're vocalizing, it immediately alerts the carriers, and that also means the carriers can be there as and when needed, as opposed to waiting for routine checks to happen as well, which improves the responsiveness, improves sleep quality, and that we've seen is also directly correlated with fall risks, as you will see Raj explain a little later in the presentation. And the system also patterns behaviors. It tells, besides simply alerting for sounds, it also works out what the pattern of behavior based on the sounds are in each of the rooms. And when that changes, it automatically sends an anomaly note to your CMS solution as well. So something very differentiated to what we do, and something that has truly benefited, especially Terrington Lodge. Hand over to Raj to talk a little bit about our journey, and then maybe run through the deployments we've had so far and the success we've seen so far, Raj.
Yeah, thanks, Brad. So, like I said, we sort of worked with Prad to get a little trial going. I think we put in about 5 or 6 monitors in 5 rooms that we thought were going to give us some results. And what we found was that the system was learning as it was going along. So as Prad said, the sounds of concern we're not recording voices or anything like that. We're registering sounds of concern. So as Prad said, coughing, moving, spluttering, shouting, screaming, doors closing. And what we had was a situation where if somebody got up in the night, typically those that were prone to fall, we had pressure mats on the floor. But by the time the pressure mat went off, that resident could actually have fallen by that time. But what Earzz does, it actually picks up when they're awake. So the carer gets alerted when they're actually up. And if we know that Joe in room 6 is actually prone to falls and he's suddenly up at night, the carer can then go to that room quickly before the resident's feet have even hit the ground. And it could be that they want to go to the toilet, it could be that they want a glass of water, it could be anything at all. But the carer can attend to that resident before their feet hit the ground and before they fall. And as we spread the trial from like 5 units to the entire home, what we found is that the quantity of falls that we had were the carers were far more responsive, were actually sort of falling literally month by month. And we went from a period, I think, of having like, well, there you go, 13 falls there in April. By August, we had virtually 0 as the staff got more and more sort of used to the system. And the other thing that, apart from just alerting the carers when the resident was up, one other thing that we found was that typically what we were doing was we were doing hourly night checks on all our residents. So you can imagine that someone's asleep, you open the door, you check that they're okay, pad's okay, whatever, and then you close the door and they could wake up just with the noise of the door shutting or the light coming on in the room or whatever, and they could be awake literally seconds after you've left the room. So what we found was that we actually started to extend the period of the night checks. So from hourly, it went to 2 hourly, and then it went to 3 hourly. And what we found was that we've almost eliminated the need for night checks now. So what that basically means is that some of our residents that were getting almost like woken up every hour to check that they were okay are now getting sort of 6 or 7 hours sleep. And that then transposed to their behavior patterns during the day. And what we found that those residents that were falling during the day suddenly didn't fall at night because they were more alert, more aware, and more sort of functional during the day because they slept better at night. So I think from our perspective, we noticed a rapid decline in falls. One of the other things that we began to monitor was obviously, nighttime, you've got skeleton staff, you don't have as many people, and as managers and providers, we don't really know what goes on at night and how responsive people are and how quick people are to attend. We hope and we pray that our carers are attending to everybody as quickly as possible. But what we found that with Earzz, we could actually find out that there was a sound of concern in minute 1, and a carer responded in minute 5 or something, and that effectively meant that we knew that carers were attending to residents, and they were attending to them quickly, and because they weren't doing night checks going round and round in circles during the building, it actually gave them time to attend to the residents that needed attention. So that was actually a way of us monitoring what the night staff were doing. Initially, I think there was a little bit of hostility amongst the staff that suddenly we know how long it takes them to answer a call, and they're not sitting having a cup of coffee and think we'll get that in 10 minutes or whatever. But what we also found was that attendance times, as we fed that back to the staff, went from sort of 15 minutes to 10 minutes to 5 minutes, and now it's all how quickly can we get to a resident. So that was a real positive outcome, apart from just the number of falls. I guess the other thing is, as Prad said, that we've got many residents that can't ring the bell or don't have the capacity to ring the bell, and again, Earzz picks up sounds of concern, and therefore we're getting to the point where if somebody shouts help or shouts for something, again, those sounds can be transposed into sort of alerts that will come up on the carer's device as sort of emergency alerts because someone's perhaps shouting for assistance. So that again is something else that's been developed in terms of we've got different types of alerts, haven't we, Brad? We've just got the normal alert that comes up, and then we've got the one with a siren almost that comes up where we feel it's urgent.
Absolutely.
And I guess the other beauty of it, as Prad said, is that we've now been able to make it person-centered as well. So the manager can say, they can set up their parameters and say, right, Joe in room 6 is more prone to falls, therefore we want sounds of concern when he wakes rather than if he's just coughing. So those alerts will come up quicker and faster and in a different way, and that again reduces the number of falls or the time that it takes for a carer to get to that resident before their feet hit the ground. So many improvements, but also the fact that we all know that night staff are busy. They've got rounds to do. They're cleaning. Skeleton staff. They've got kitchen stuff to do. They're cleaning stuff to do. And of course, this now gives them just that bit more time to concentrate on not just the residents that they're looking after and those that need attention, but to do the other tasks that they have to do. So it makes their life a lot easier as well. So we found a lot of improvements that this system has brought. And again, as Prad said, we've added features onto it. We've almost in one home we're trialing the replacement of a nurse call system, where our nurse call system needed replacing. We thought, no, we're going to get Earzz in. We're going to see how that works and see if that can replace the nurse call system. So with that, we've put additional buttons in the room that can be pressed, but also we've got the button on the unit itself. And so far, what we found is that actually it's almost replaced the nurse call system. One of the other things that we've sort of added on there is the we all know that CQC and PAMS and the quality assurance officers all want us to check temperatures like twice a day in every room, and at the moment you stick a thermometer in every room, somebody has to walk around and they literally have to take the temperature, put it on a chart in that room, and then we have to demonstrate that we've been doing that twice a day, particularly during the summer and in winter when it's extreme temperatures. And what Earzz have come up with is a system that bolts onto that actually monitors the temperature but only alerts when it's out of the range that we set. So for instance, you can have a monitor in a fridge which you want to set between 0 and 5 degrees, and if it goes out of that range it will alert us. But in a bedroom you want it between sort of 18 and 24, say, for instance, and therefore it will alert you if it drops to 17 or rises above 25. So again, you can person center a lot of this. It all works through the same system. So it's a system that's developing, and it's the use of AI and it's the use of technology that we've found is actually going to reduce the sort of manpower that we need to complete a lot of these tasks. And I think that's where we've seen, huge improvements in what we do.
Thank you, Raj. One, maybe you can also elaborate on which homes we've deployed in and talk through the journey that we've taken. I think we went step by step here, didn't we? So we started off at Terrington, which we then deployed into, and then we moved on to the others as well. So do you want to talk a little bit about the journey?
Yeah, sure. So the trial started in Terrington with literally 5 units, and we ran that for about 6 months. And after about 6 months, we deployed the whole home, so every bedroom, even down to living rooms and dining room. We put the Earzz monitors in everywhere, because again, if there was a fall or a shout or a scream, it would alert that someone was in distress in that area. Like I said, originally the staff were not so much in favour of it, because it meant that the Earzz report would tell us how long it took to respond in. But now they're used to it; it's embedded in their culture. And from that, we've deployed that to Docking House, which is a little bit more of a challenging home, where we have far more challenging sort of residents there than we do in Terrington. And again, we've embedded that process as part and parcel. We've got 40 odd residents there, and again, we've seen improvements there. And just I think last month we introduced it into Whitehaven, which is in Sheringham. It's a small home, but again, there we didn't have a nurse call system, so we're just sort of working with all these new metrics that Earzz have sort of put in, and it seems to be working well. Again, it's sort of reduced the number of falls that people are having. It's alerting us in time. And I think now we've got our remaining 3 homes, but we are sort of going home by home, monitoring it, assessing what we need, and reducing our reliance on sort of hourly checks, reducing our reliance on pressure mats. I mean, we were buying pressure mats like they were going out of fashion, because they keep breaking. The wires keep coming out. They keep getting pulled. A carer would fold them in half and shove them under the bed, or they weren't placed, or they were not switched on, or something wasn't working. And now we're relying on technology to replace those pressure mats. So pressure mats we've been using for ever since I've been in care, it was over like 25 years. And now we're suddenly finding that technology is no longer necessary. You don't have to have a pressure mat with a cable that runs halfway around the room, for instance. A discrete monitor sitting on the side, probably 18 inches away from the corner of the bed, that monitors the entire room. So we've seen savings there. What we're saving on pressure mats is probably what we're spending on Earzz.
And you talked about the savings there. Could you also talk a little more about the ROI that you're seeing on the safety records, the occupancy, that angle as well here?
Yeah, so we all know that if somebody falls, the time that it takes to deal with that fall, to document it, for a carer to sit with a resident, while they're waiting for paramedics to come out, and we've had occasions where somebody's fallen on a floor, suspected hip break. We've had carers with them for almost 20 hours, day and night, while they've been on the floor waiting for an ambulance to turn up. Now, what is the cost of that? The mere cost of a carer sitting with that person. So not just that, but also when that person goes to hospital, you've got to send somebody with them. Then they're in hospital, and we all know that, unfortunately, when somebody goes into hospital with a broken hip or suspected broken hip, their mobility is often quite worse when they come out, and they tend to deteriorate more. So what we've found is that less falls means less hospital visits and admissions, and therefore your residents are healthier and with you for longer. So that also makes a huge difference to I guess your return on your investment. What you're spending on the system is actually quite minuscule. When you tell families and things that this is a fall detection system that's new, it's AI driven, they also feel a little bit more secure that actually you're implementing the latest sort of things there. So yes, we have noticed it. It's not almost always as tangible as like, okay, one monitor will give you £10 a week in savings, but what you notice is the savings in staff time, the savings in stress and the burnout that staff have to have, the number of paramedic visits, the number of hospital admissions, the number of going to the hospital to reassess those people, to bring them back, and possibly hospital beds when they come back. All those sort of things are a huge saving on management time as well as carer time. And the benefit to the residents is you just can't put a value on that.
Thank you, Raj. And just to elaborate on the fall reduction numbers, Raj mentioned this, but again, huge thanks to Vicky. I don't know if Vicky's in the call, but she did a fantastic job in getting the system implemented at Terrington. But these numbers are quite compelling. We're talking about a huge drop from 20 plus falls a month, but 13 just in the bedrooms, down to about 0 here, as you can see in the graph. But what was also interesting was how the system was used by the management team there to help understand patterns of behavior using what preceded, so using the sounds that preceded falls. And I thought it'd be useful to spend maybe a couple of minutes, Raj, on the patterns of behavior. I could just run through the graphs if you don't mind, and then maybe you can elaborate after. So what we were seeing here, just for everybody's benefit, is when you looked at the numbers of falls, there was one repeat faller that was contributing a lot to the numbers that you saw. So, but what was very interesting was when there was a fall, when we went back to the data and started looking at what preceded the fall, it was clear that the person tended to vocalize a lot. So what you're seeing here is one such an event where the blue streaks here show the sounds of shouting, the blue are movement, the green are movement, and you can see that the person was vocalizing a lot more before the fall was reported in this case. And interestingly, the system picked that up. The system does not need, you don't need to actively look at the data. The system can do that data crunching for you. And it can then send an anomaly note saying this person tends to vocalize a lot more than usual. And that's a note that is sent straight into your care planning systems as well if the integration is in place. And what was interesting here is when we started then looking at the trends of falls in the room for the repeat faller, it was clear that every time the person fell, the night before, the person was quite restless. They were moving or shouting a lot more in the nights before. And this goes back to the same argument that Raj put forth before, where how sleep was so closely interlinked and restlessness was closely interlinked with the fall risk. And that's when we at Earzz started doing a lot more due diligence on our side to understand what this correlation really was, what it meant. And interestingly, we found a lot of research papers in medical journals that talked about this correlation. As an example, I've just listed one here, which is sleep disturbance and falls in older people. And we then began compiling a lot of our data across all of the homes that we serve. And this was remarkable. About 70 to 80% of the cases where there were falls happening, we were seeing an increased restlessness quotient that in the nights prior to the fall event. And so we were therefore thinking what was very important here was to get the system to alert the carers, not just a few, or even the management team, not just a few seconds, a few minutes before, but actually the very morning when there is a change in restlessness pattern. And that was remarkable because the moment we understood that there was this correlation, we could then make the system triage the alerts. And that's what Raj was referring to before when he said some of the sounds, some of the alerts could come through as sirens or different sounds. And the system can therefore recognize when there is a change in restlessness for each of the individuals, and then triage those, make those more urgent in terms of responses. And that's what we did with Vicky's help as well at Terrington. And in this case, for this specific room, we changed the alerting schema for vocalization because anytime the person shouted, the risk was higher than usual based on the data that we had from that room. And that made a remarkable change. And you can see those in the numbers, number of falls that were dropping as well month on month. So again, the management team there was quite proactive. They used the data to make the life of the resident a lot better. So well done to the team, and we were glad we could help as well in the process. And a similar sort of story at Docking House, where you have increased coughing, and this was something that was spotted both by the system and by the manager there. What was interesting is the system could, because it delineates and recognizes the sounds all by itself. It could also count the episodes of coughing. So what you're seeing here are the coughing trends across each of the rooms. And the moment there was an increased coughing happening in each of the rooms, that surge was recognized by the system, alerted the manager, and this was something they could use to see how the infection was spreading across the home if there was one, and also curb it before the spread started. So again, quite valuable, and Sherry did a fantastic job on this front as well. Anything you want to add here, Raj?
Yeah, I mean, I think coming up to winter, this is a very interesting feature because obviously, yeah, we've got a lot more winter colds and flus and all sorts of things. And as Prad says, it detects that element when people start to cough, and if you've got a particular area of the home where you've got 4 or 5 people suddenly start coughing, you then know maybe should you wear masks, should you wear more PPE. What you don't want to do is go into a room where somebody's been vocal and coughing overnight and then go into another room without that. So you can start taking precautions as well, and stop the spread of any sort of cold or flu or anything like that. So these sort of measures are really looking ahead. I mean, when we look back to COVID, for instance, we if you had a spread of COVID, you didn't quite know until it was too late. So we're hoping that systems like this will actually help us to identify, particularly coming up to winter, when we know that people get a lot more colds and flus and chest infections and things. If there's a pattern in one wing, or people sitting in one lounge, or that sort of thing, and the system is clever enough now to actually work out where people are and where it's happening. And again, like Brad said, we can start almost running like a triage service, that we can preempt some of these issues and take the necessary action to make sure that we sort of limit any sort of harm that comes to anybody.
Thank you, Raj. So in terms of what we have from an integration perspective, Raj mentioned this integration with call button. So that's something that we are rolling out now in Whitehaven. And this is something that we're working on. So for those who have the mental capacity to push a button, you also have the button capability, the call button capability, but you obviously have the acoustic monitoring over and above that too, to try and ensure that even nonverbal sounds are picked up and alerted for. And we also integrate with the likes of care management systems. So in this case, we today integrate with PCS and Care Vision, and we send a lot of the information that you've just seen straight into the CMS software as well. So care attendance records, care notes, you can write a note in our system, which will get fed into the PCS or Care Vision ecosystem as well, and equally the other way. And the behavioral anomaly note is where we truly stand apart. It's a system that doesn't just alert for sounds, it actually uses the sounds to pattern the behaviors of people. And when that behavior changes, that's specific to the resident. If that behavior changes, it also then sends an immediate alert. So if there is a change in restlessness patterns at night, if they've got a lot more restless, if they're shouting a lot more, if they're coughing a lot more. So these are things that you don't need to, as a manager, go into the system, log into the system and analyze the data. The system does the analysis for you and then sends that note straight to you. And that's a key differentiator that can mean the difference between a fall and no fall as well in many instances, as we've seen in the past. And so in terms of what we offer, we've got the passive listening device, which is the monitor in itself. It's this little pod size of a golf ball that just sits passively by the resident's bed. And then you've got the real-time alerting capability for specific sounds of concern that you choose. And again, it's person-centered. You could choose the sounds to alert for based on the person's needs. From a behavioral patterning perspective, it then uses the sounds to analyze the patterns of behavior, and then it could alert for those changes in the patterns of behavior as well. And all of this is integrated into your care management system, and that's something we do currently with PCS and Care Vision, but open to doing more. And we also integrate with the wider ecosystem, and we learn based on the feedback. And we're lucky to have had Raj's group here, who gave us a lot of feedback, and we learned from it, and we improved upon it as quickly as we possibly could. So that's what we've done here. Anything you want to add here, Raj, before we open up for questions?
Yeah, I think I'd like to just a couple of things. I mean, firstly, with Earzz, we never sort of came across it before, and we there's a lot of improvements and feedback that we gave, and we said, do you think it could do this, or do you think it could do that? And whereas with, say, other care provider software sort of packages, it would take months to get something done. What we found with Earzz was that when we said something in the morning, they'd come back in the afternoon. Is this what you meant? And we thought, oh my God, that's happened. Yeah, we talked about the nurse call system, and by the end of the week, we had built a nurse call system. We talked about the temperature monitoring, and by the end of the week, you'd managed to source temperature monitoring and put that into the system. So, you know, what we found is that it's just been so refreshing, and I think the thing is, we are always afraid to break new ground, look at new technology, always want someone else to test it first. This magic word called AI, which people use in different ways. So many people say, oh yeah, ours is AI driven, and actually it's not, it's pre-programmed or whatever. But with Earzz, it is AI driven because it actually learns. So the more people cough into the system, the more it's learning and the better it's getting. And yeah, if you've got particular residents, it actually learns about those residents in that room, and the managers have some control to person center everything. And that's what CQC are looking for. They're looking for personal centered care. That's what your quality assurance officer is looking for. He's looking for, you know, how you personalize care, and this is one of the things that we can do to prove it. Now, at the end of the day, you know, if someone said to me, oh, do you know, for an extra £1 a day or whatever, you can look after mum or dad with this AI monitoring device, it's a no-brainer, really. You know, it really isn't. And the level of benefits that you get, you can't quantify that in terms of what it costs you. And I've seen systems that are, you know, infrared monitoring and this monitoring, and they cost thousands. You know, and here we're talking about £1 a day, and it's developing all the time, and it's getting better, and there's add-ons and other bits and so many things that you can do, and it will save you so much time in terms of the manual stuff that we don't want to do. And it almost takes me back to like 25 years ago. We spent probably 80% of our time caring and 20% on admin stuff. Now we spend 80% of our time on admin and 20% on caring. And we want to try and get back that way. And anything that's mundane and routine, like monitoring and yeah, all this sort of stuff, if we can push that over to AI functions like Earzz, and then it gives us more time to spend with residents and to do the caring. Like I said, if anybody wants to see it live, because it's all very well hearing about it in a webinar, if somebody wants to see it working live in action, yeah, we've got a project manager that's basically looking after this system now, and sort of quite dedicated to it across all our homes. We'd be more than happy to show it to you in a home that's near you, see it working, see what data we get, how it's improved, what we do and how we do it. And so you're more than welcome to come and have a look.